Hello, welcome everyone. Welcome to this second year anatomy seminar in which we are going to talk about and we are going to get into the details of the liver and the biliary anatomy. First of all, we need to gather some technical information which is crucial for acquiring good images. And the first one is the probe. What kind of probe do we need? A curvilinear probe, which is exactly the name of this probe you're actually looking in the screen. And it's a low frequency probe, which is especially and specifically designed for looking at the abdomen and abdominal organs and structures as well. So, first question is, where is the liver? Actually, the liver is supposed to be an abdominal organ, but is positioned below the ribs. So it's actually positioned in the theoretical thorax. So for assessing the liver, we are going to use different approaches. And the first one is the longitudinal scan at the level of epigastrium. Remember to place the probe marker towards the patient's head because it's a pure sagittal scan. So this is the view we are gonna identify with this cut exactly at the level of epigastrium. So the main part of the organ you are looking at in the screen is the liver, and it's especially the left liver lobe. There's a line separating two different structures, which is this. So the different structures are the venous ligament, which is the line, and the caudate lobe, which is inferior or actually more posterior to the left liver lobe. Posterior to the caudate lobe, you are looking at these white structures with posterior shadowings, which is the spine. Okay, the second scan is totally perpendicular to the first one, so it's a pure transversal scan at the same level, at the level of epigastrium. We're looking at this structure right in the middle, which is superficial, and it's an organ-like, which is exactly the same. Is this the left liver lobe, left lobe of the liver, and the caudate lobe now is more inferior, more posterior. Actually, it's more depth, and it's between those vessels, which are supposed to be the great vessels, the aorta and the inferior vena cava. On top of the caudate lobe, you can identify as well the venous ligament. These two approaches are perfect to assess the left liver lobe, but when we need to get on details of the right liver lobe, we need to put or to place our probe into an oblique position, placing the probe marker towards the patient's right. So it's an actual subcostal oblique scan. We can fan up and down from more superficial to more depth to more deep cut or scans, so we will see different structures. But mainly the biggest part of the organ is the right liver lobe, and the most deep part of the screen is the diaphragm. So we are actually looking at from superficial, which is anterior, to deep, which is actually posterior and superior. So right liver lobe and diaphragm. And we are actually looking at a lot of stuff inside, like vessels, like structures. So the first cut we're gonna identify is this one. The three hepatic veins, which are gathering into the inferior vena cava. So remember, the right hepatic vein has kind of a white wall, which is different to the mid and the left hepatic vein. The next cut is at the level of this structure, which is a vessel with a great white wall around. And these big vessels is the portal vein. On top, there are two different structures. One of them is the hepatic artery, and the other is the common bile duct. It's super easy to identify which one of the structures on top of the portal vein is the artery and which one is the bile duct, just placing the color mode. So the structure with flow is supposed to be the artery, and the structure without flow is supposed to be the common bile duct. So these three structures are located in every single unit or functional unit of the liver, and this is the portal triad. In the next cut, we are looking at the big fluid-filled structure, which is the gallbladder. Gallbladder is touching the inferior side of the liver, and the inferior part, the deepest part of the gallbladder is touching actual gas, bowel gas. From time to time, we can find this structure with shadow, which actually looks like a calcification or looks like an abnormal structure, but it's not. It's the teres ligament. You see in the between left and right liver ligament, and immediately left to the gallbladder in this cut. Okay, is there any tips or tricks or things we can do for obtaining or optimizing the image of the liver and the biliary tree? Yeah, of course. So if we ask our patient to get to deep breath, to get a deep breath in, everything will move down. So everything will move move closer to our probe because the diaphragm is pushing down all the organs, in this case the liver and the biliary tree. If the patient has no window, go intercostal. So go exactly where the liver is. And remember, we are looking at different structures, depends on the angle we are facing or we are fanning our probe. If we scan the abdomen into a pyramidal scan, actually a coronal scan, in the mid-axillary line, we can identify in this clip that the right liver lobe is actually in contact with the right kidney, which is the structure in the middle of the screen. So that's all. Thanks for watching.